I'm going to call to order the October 17, 2012 meeting of the Edina Community Health Committee to order. Can I have the roll call, please?
Jeff?
Here.
Kumar? Matt?
Here.
Janet?
Here.
Mary Jo? Kaya? Nancy? Here. Carolyn?
Here.
Adman? Helen?
Thank you. Next item, approval of the meeting agenda.
I move for approval of the meeting agenda.
In favor?
Aye. Aye.
The agenda is approved. Approval of the minutes from the regular meeting of September 11, 2012.
I second.
Those in favor?
Aye.
Minutes are approved. Next agenda item, agenda 5, community comment. There's no community comment. We'll move on to the next agenda item, which is item 6, reports and recommendations. And first up, we have Public Health Emergency Preparedness Services Review, Lisa Brodsky from Bloomington Public Health Emergency. She's the Bloomington Public Health Emergency Preparedness Coordinator.
If it's okay, if I could go first.
Sure. So we'll move agenda item B up. Community Health Service Review, Karen Zelznick, Bloomington Public Health Director.
Great, thank you very much. We are here tonight to present kind of our yearly report on the public health services and public health emergency preparedness services provided by Bloomington Public Health on your behalf. Lisa Brodsky is with me, and she'll talk about emergency preparedness. And first, I'm going to do a brief review of the duties of the Community Health Board, since you are an advisory board to your Community Health Board. And I'll review some of the 2012 highlights and talk about what's new for 2013 as far as we know, since we're getting so close. And I'll also be happy to answer any questions you might have about our 2011 report. But you know, by the time I get here, 2011 seems like a long time away. So, but any questions you have, I'll take questions, or you can interrupt me, or I can take them at the end, whatever is your pleasure. So, I'm addressing you tonight in your role as advisory board, your Community Health Board advisory to your Community Health Board. And as you know, there are several requirements that must be fulfilled under Statute 145A. And you can see it right there before you. Community Health Boards accepting local public health grants must document progress towards the statewide outcomes established in Chapter 145A, Subdivision 7, to maintain eligibility to keep on receiving the local public health grant dollars. And as part of that, there are further requirements for planning, that you must establish local public health priorities based on an assessment of community health needs and assets. And we have started working on that, but in 2012, we'll be working with you to establish your 10 priority health needs that need to be submitted to MDH. And then also, another requirement is to determine the mechanisms by which the board will address the local public health priorities. Now, some of those are outlined for us already because they're outlined in grants. So some of that there's some flexibility, but most of it is designated by grant outcomes. And then working with Sherry Engelman, we make sure that a statewide report is completed each year that is also required by MDH. And then you'll see in the next slide, I just have listed for you that these state dollars must be used to support the 6 areas of public health responsibility. This is assuring an adequate public health infrastructure so that it's in place when it is needed and to make sure that's strong, preventing the spread of infectious disease, promoting healthy communities and healthy behaviors, preparing for and responding to disasters and assisting communities in recovery, and protecting against environmental hazards. And then a last one is assuring the quality and accessibility to health services. So as our communities take a look at those 6 things, they are a little bit descriptive, but still very broad. So our grants, again, will tell us in more detail in terms of some of the things that we have to provide. So to fulfill the state requirements, we deliver a wide variety of public health services to Edina residents, including services to individuals. That's one kind of service. And examples of that we may be making home visits. We're also in the community at locations such as the Edina Resource Center, the schools, the Edina Family Center, the Senior Center, and also we provide services out of our Public Health Center. So that's services to seniors, and examples, well, we'll get into more examples of that, but we also provide consultation with the Edina school nurses, who I know you heard from, it looks like at your last meeting, to clinics around immunizations, child care providers on childhood infectious diseases, safety, and resources. So a lot of consultation, and I'll be talking a little bit about that later. And something that we provide to you in terms of, well, let me see, well, there's one more thing here. More recently, you've been hearing more about our work with community partners to create policy systems and environmental changes. You know, that's that hard work. It takes a long time to do in many cases, but it results in more lasting and sustainable changes. And an example of that where we worked with city partners was in changing the ordinance to allow a farmer's market. And that's now been, is this the third or fourth? Must be the third year. So that was, that took some time to do, but it resulted in something that was sustainable over time that allows farmers markets. And so we create on a yearly basis our annual report, but we also give quarterly reports to you all. And one of the things that we added several years ago was some narrative to the annual reports, because not all of our work is being able to be counted in numbers. Certainly the services to individuals, those are much more concrete, but some of the consultation and some of the policy and environmental work, you just have to be able to describe that in a little bit different way. So I'm hoping that those remain useful to you. One of the responsibilities is in planning and reporting, and we have written grants in the past and will continue to do so in the future to expand public health services in Edina. One example of this is the SHIP grant, which included all 3 communities that we serve, including Edina. We've also have to implement community health assessment activities, identify and prioritize local health issues, and develop action plans. Those are all things that we're going to be working on in 2013. And then I already talked about completing reports to MDH, which it seems like as the years go by, those get to be more and more detailed and numerous, I might add. So I wanted to just review with you briefly to share some demographic information with you. Demographics really give us an insight into some of the health issues and the health inequities that are in our communities. So you've probably seen something like this before. The populations have shifted a little bit in all 3 cities, decreased a little bit in Bloomington, but you'll notice Edina has increased a little bit, as has Richfield. One of the reasons why that's important is because a lot of our grant dollars are based on population. And then in this next one, there's a lot of information here, but I gave this to you just so that you can see the percentages of the shift in your ethnic distribution, your racial and ethnic distribution. And then this next slide, actually, Edina's in the center, but you can see the contrast between 2000 and 2010. So you'll notice that you've got quite a significant increase in your diversity of your population there. And we've laid out, where the diversity is happening. So you've got the green is the Hispanic Latino population, the black is the African American, that orange, which I don't believe, you don't have any of that orange, but then that other color that's kind of yellowish is the Asian Pacific Islander. And I know that when you talk to the school district people, that they really have felt that change in the diversity of the population. And actually, this next slide then talks about the free and reduced lunches. And the reason why we look at this is because this is a proxy for poverty. And you'll see that all three cities have experienced an increase, although Edina has the least amount of increase. If you go even further back, you'll see that I believe it was, let me just double check here, I believe it was 1999, the rate was 2.2%. So you'll see that over time, that is really a significant increase for Edina, going from 2.2 to 9%. And even, there's just, you can just see over the years it has gradually increased. And so that means a shift in the population, a shift in the needs of the population, and really a shift in some of the health inequities that we're going to be seeing. And then the next three graphs are some newer graphs, and you'll be seeing more of these because Lisa, our emergency preparedness coordinator, our manager, she has put together these for emergency preparedness purposes, but I thought you might be interested in seeing these. So the first one talks about the population living at or below 200% of the federal poverty level. And you see the darker the green, the larger the percent. So your largest percent is somewhere between 18, almost 19% and 30%. And you'll probably not surprise it's over in that southeast portion of Edina. And then the next one, and of course we're interested because these would be some of the people that we'd be targeting, some of those individuals for some of our individual services. The next one is taking a look at 65 years and older, and you'll see that you're starting to see more of the dark purple. And you know this is probably no surprise, but you're just seeing it mapped out now in terms of the different parts of the city. Yes.
You said you target. How do you target? What's the methods you target those populations?
Well, one of the ways we do it is through making sure that our brochures are at the Edina Resource Center, and we have a nurse who actually works a half a day a week at the Edina Resource Center, so when calls come in there. MDH actually does a lot of the outreach for our WIC program, and many times it's by word of mouth is the best way to get that word out. But I would say that targeting some of our services or doing outreach for some of our services, and we also use the city as one of the places who can help do outreach for our services. It is a challenge when you have a smaller portion of the population you're trying to target. Good question. And then the last slide takes a look at the population 80 years and older, because we know besides looking at the vulnerable population with our kids, also we know that people 80 years and older, they are going to be more vulnerable in terms of their health conditions. Now the question, there's not a map overlay here on this particular map that shows the streets, so you have to kind of figure out where those places are. But we know that in some places in Edina, you're going to have the high rises or the places that are more densely populated with apartments, condos. And then we've got other places that are going to be housing, so the single family dwellings. So that's probably more work that we need to do, but it's interesting just to take a look and see where the population is on these maps. So you'll be hearing more about this in the future as we take a look at some of the issues in emergency preparedness. So then I'm going to move on and talk about high-risk home assessments for vulnerable adults and seniors, and we have mapped this out. You won't see this in our annual report, but we took a deeper look at some of the service provision data for across the years just for Edina. And so you'll see that the yellow column is for clients and the green one is for numbers of visits. So these are the folks where we have gotten referrals either from environmental health, from Sherry's division, or from the police department, or from friends or relatives, people just calling us to say, we have a family member we think needs some help, or they've fallen in the home and the police are making a referral. So these are folks where we'll go out, knock on doors, make phone calls, and in many cases they will need more than one visit. So these are usually complex cases where people either need more resources, or in some cases they just need to move and get more services. They need to move maybe to assisted living or even into a nursing home. So these are, you can see over the years, we wanted to show you kind of this, it's been a fairly steady increase since 2006.
And do you have a understanding as to why that increase has occurred?
I think it's just reflecting the aging of the population. So some of it's the aging of the population, and some of this is because these are not all elderly people, but usually they have some sort of disability. So it's both of those things.
I have a quick question also about
Yes.
this. How many of these can you tell are repeat from year to year? Are these unduplicated numbers? Are they brand new clients every year, or are there going to be a number from 11 that were also part of the stats in 10 and 9? That would have that kind of repeat visit from year to year.
We'd have to look deeper into our data. That's a good question. I don't think that there's a lot of repeats on those, but there may be some. But the ideal is for those, to get people enough resources and to get them connected with their family. And in some cases what we're seeing over the past few years is that people are coming in probably that have more complex family dynamics going on. And in some cases, we've had a few cases where we've had, adult children of elderly people who are taking advantage of them. So in that cases, it may be the adult children that are really the problem. And in other cases, the dynamics are so bad that really they don't want to have anything to do with each other. So there's all those kinds of things that are happening in some of these families. So we're seeing families just with complex issues. And that's been, I think, something that's been growing over the years.
Karen, I'm wondering, are you seeing any increase in things like chemical dependency, for example, among seniors that are triggering some of these, or vulnerable adults that are triggering some of these visits?
I don't know if we would see a trend that way, but certainly some of the people that we are seeing have some issues around chemical dependency. And one of the things we take a look at, we do not do an assessment like somebody would get in a doctor's office, but our nurses are out there and they will do a health assessment, a general health assessment. And one of the questions we may be asking is what kind of medications that they're on or what are prescribed, and then to see if they are taking them, because in some cases people may be off their medications and they need to be on them. So those are the kinds of things that we assess. We do the physical assessment and then we do a psychosocial assessment.
I'm wondering if you have the ability to assess sort of the data to find out where some of these gaps are. In other words, any idea about how many people might need follow-up services for medication management or might need follow-up services for placement or, that sort of thing. Do you keep those kinds of statistics?
We don't. We would have to actually get into the charts and take a look at that. But you'll notice that in the quarterly report that we send you each month, we usually have a breakdown of the referrals and what kind of referral it was. And then we usually try and give a little short snippet of one example of a case that and that's the most that we have done so far. And it's hard to know how big of the tip of the iceberg that we're seeing on this. And it's one of those things where, as you get more into the community, that's where you start, we get referrals from the community. You really can't do a house-to-house kind of knocking on the door. But we really look to community partners. And it's kind of sad to say, but in some cases, you don't get referrals until things are pretty bad in the home.
Are you allowed to visit multiple times, or do you visit once, make an assessment, and pass it to a different, like
We
a
can
home
make
health type situation? Or
Yes, we will make multiple visits if that's what's needed. And especially, somebody was asking, do we have repeats? And Garbage House is the place where you most likely might see some repeats. So our nurses, we have the ability to, with their permission, to go back and make several home visits, or sometimes we'll say, can we just come back in another 3 months to touch base with you, see how things are going? Especially if they've had to do a cleanup. Because you want to try and do some, you just want to try and make sure that someone's in touch with that person, that someone can get into the house to actually see. But it's all, from a public health standpoint, it's with their permission. I think in this case, it's environmental health that carries the heavy club. We're the good cop. It's a good cop, bad cop kind of thing. But we really work with people to try and develop those relationships, trusting relationships, so they'll let us back in. So, and for those people who we think could really benefit from follow-up, we have the ability to do that. There is no income eligibility for this service. It's paid for the most part, either with some city tax dollars, probably a combination of city tax dollars and the local public health grant. So we just do it. We call these our vulnerable adult visits. The county also has a role, but the county will not accept these cases until they are quite serious. And so we get them before that. And so moving on to some more highlights from 2012, you've been hearing about Dewtown probably all this year. Just a reminder that we had the kickoff last year in September. And I know that people have been involved in that, and you'll be hearing more from, I see Sarah in the audience, and you'll be hearing more from Sarah tonight, but that started a year ago. We feel that one of the successes has been food changes at the concession stands. Safe routes to school, that partnership with the school district, we have just started those meetings in the last couple of months, so we'll keep you posted on that. Mainly a lot of that work being done this year and into next year. And then the Tri-City Partners, TCP is Tri-City Partners. They had a training for coaches and athletes, and that was a very successful event. And that happened in, I believe, it was either June or July this year. Disease prevention and control. There's been a pertussis outbreak going on, and that continues. We have had 45 pertussis cases in Edina. I believe we've had 48 in Bloomington, and quite, let me see, I think I have the numbers for Richfield. 17 in Richfield. So Bloomington and Edina are ahead of the pack here. And I know that I was talking to Karen Stanley, our manager of that area, and she said that for Edina, that she spent a lot of time in consultation with this is one area where we spend a lot of time with the school nurses. And sometimes they are reporting cases to us first. We're following up the families, trying to figure out who needs to be notified, who needs to get vaccinated. So we have worked really closely with the school nurses. And I think late last year, as this was just starting, we were almost in daily contact with some of the nurses in Edina. It's just a very time-intensive kind of thing, but very critical. And you know, pertussis kind of ebbs and flows, but we're hearing about this nationwide with pertussis. And then the other issue I might mention here is meningitis, because meningitis has really been in the news. I just heard on the way over here that I think we have 2 new cases now in Minnesota. And our role in that is really sending out information from MDH to the providers. We've got our HAN alert going.
And on the pertussis, is that just a function of increased lack of immunization? Is that your kind of early assessment of that, or?
Well, one of the things that's happening is that they need to get the kids need to get boosters. And so I think the boosters are required in 7th grade, but where we started seeing pertussis first was in 5th and 6th graders. So, you know, something may need to change with having the booster required sooner versus later. So that's where we first started seeing them. And some of the younger kids, it may be that they just didn't have a good response to the vaccine itself. But we've also had some cases in older adults and one in more of a senior who got very sick. So it's a serious situation, especially for those people who are around kids a lot. In our clinic service, one program we're very excited about, the staff is the WIC Peer Breastfeeding Counselor Program. It's where we have hired peers to help counsel the WIC clients on breastfeeding. And it's been in effect now. Well, we had this grant starting late last year that we started training our peer counselors. But we've had a Somali peer counselor, a couple of Latinos, African American, so a pretty diverse group. And people are very excited about it. They love it. I mean, the WIC clients are very excited about it. So we're hoping next year that we'll have some outcomes to report, because we're hoping to see that women breastfeed longer, because we really have a very good initiation rate, but we'd like to see them breastfeeding longer. And another thing that I'm happy to report is that Fairview Southdale Hospital, I've been serving on their community health steering committee, and they're doing some assessment work and planning work, but they are in the process of becoming a baby-friendly hospital. So it's kind of like we're all on the same page here. We want good birth outcomes, and we want babies that are breastfed and moms that are breastfeeding, and that we've got happy families with babies and moms off to a good start. And then the flu shots. We're in the midst of giving out flu shots now. And the other interesting piece around this is that we're seeing a lot more interest, especially with school personnel, in getting pertussis shots. So, people are very, very much aware of this. And as we go around, giving the flu shots, we have just ordered a lot more vaccine because people are asking for it. That and the pneumonia vaccine are two other vaccinations that we can give at flu shot clinics. Okay. And we've talked already, I'm just services to seniors we talked a lot about. The other issue that we're seeing more of probably is hoarding. And so our nurses are kind of getting ramped up on skills around hoarding. And Sue Sheridan, our nurse supervisor in this area, is on a state task force that's taking up hoarding. Tough issue. Family health, we have some new funding for what we're calling intensive home visiting. And we have just finished training our nurses. It's like 3 weeks of training, of intensive training for our nurses to get trained in this. It's an evidence-based model that has been proven to work to reduce risk factors and to assure that babies and parents get off to a good start. So it all starts out with a parent survey, hopefully when they're pregnant. And this takes a look at different risk factors that they might have, including was there any abuse in their family growing up? Physical, sexual abuse? Do they have any drug issues, drugs or drinking issues? Those kinds of things. So it's really people who they have a lot of risk factors in their background, and so we want to make sure that they have we know that with intensive services, we can get that family off to a good start to try and overcome some of the things in their past. So the whole goal of this program, or at least one of them, is to try and reduce child abuse and to reduce the cost of out-of-home placement, because out-of-home placement for kids is a big cost to the county. So the county is all about trying to control cost. So this is one of the ways that we know is evidence-based that works. And this was actually funded in the new Healthcare Reform Act at the federal level. So selfishly, in terms of public health, there are a lot of good things in that Healthcare Reform Act. Whether you agree with everything, there are a lot of good things in there for families and for health promotion efforts. So this is one of the things they're funding. And then in terms of planning efforts, we participated with the 5 community boards in Hennepin County to put together the Community Health Improvement Plan in partnership with we were really targeting the big systems, schools, hospitals, clinics. And so that group, and I think some of you might have gone to some of those meetings. There are a series of 3 meetings. Okay, so a couple of you are nodding your heads. Well, these are the 3 things that we came up with as problems. And you can see they're kind of broad. Maternal and child health. And maternal and child health will really focus on some school readiness. And I would say that our maternal child health activities, we know that if we start from day 1 and we work with parents, that those kids are going to be much more prepared for kindergarten. Nutrition, obesity, and physical activity. I mean, that's probably none of these are probably big surprises. And then social and emotional well-being. So trying to work more on the health promotion end of mental health versus talking about even early detection and treatment. Even though we know those are important, we're trying to work on the health promotion end of that and calling it social and emotional well-being. And then we also had 2 areas that kind of went through all these 3 problems, and they were the social determinants of health, education, jobs, where people live, poverty, and then the other issue is access. So we have 3 primary issues with the other 2 issues woven in there. And then I already mentioned that I have been serving on the Fairview Southdale Hospital Community Health Steering Committee, representing the public health services that we provide for all 3 cities. And they have just finished their needs assessment and implementation plan. All the under healthcare reform and with new IRS requirements, not-for-profit hospitals are required to do a community health assessment and an implementation plan. So in Minnesota, we have public health, community health boards must do this, not-for-profit hospitals must do this, and health plans have to write a collaboration plan. So we've got everybody kind of trying to do the same thing, and there's a lot of overlap. So that's something that as a community we're trying to fix. But this is the first time through for the hospitals having to do this, so we hope that this will go smoother as we all try and gear up for this in the next go-around. And then just quickly, our activities for 2013. Community food partnership. We've had a community food partnership group that's been meeting for about the past 6 months, doing an assessment around food and affordability and accessibility of food. Carrie Cabe from the Edina Resource Center has been sitting on that work group. Veep has all been actually as not only our local food shelf, but also the largest food shelf in Minnesota. They've been sitting on that work group. So we hope to come out with our findings and recommendations probably early next year, and that may be something that you may want to hear about in particular. Tobacco activities. We are starting some work under one of our grants for Bloomington, but we hope in the future that that will roll out also to Edina and then to Richfield. So tobacco still remains an issue. We have done great work in tobacco, but tobacco companies, the big marketing is going to our youth. And we know that the smoking rate for adults is much lower than it is for like our 18 to 24-year-olds. So we still have work to do. So that will be, you'll be hearing more about that in the future. SHIP funding, as you probably know, ends the middle of next year, June 30th. And so there is work to be done as our new legislators are elected and to educate them on the good stuff that SHIP can do. We need to start implementing our community health improvement plan, and then we have new requirements for our local public health assessment and planning process, and we'll be working with you to meet those requirements more intensely. The work will start in 2013. Which includes that identification of your top community health issues. And then I think I will turn it over to Lisa, unless you have any questions for me, but I can bring Lisa up and then we can take more questions. Okay, Lisa.
I apologize in advance. I'm losing my voice a bit and I got a bit of a cough. It's not pertussis though. So excuse me. I only have the one slide and I'm just going to talk, if I can get it to go. I'm going to talk a little bit about some of the highlights for 2012 and what we've been working on, as well as what we plan to do for 2013. As you probably know, if you were here this summer, it was very, very hot. And right about at the time that we started seeing the temperatures increase, we started doing data collection for a heat response plan in case it got hot, and it actually did. So some of the work that we started doing, you saw some of the products of that where we started mapping out some of the populations of who would be at risk for adverse outcomes for heat. And I'm going to come back another time and really kind of walk through the whole heat plan, but there was a question about targeting. And some of the work that we did with our mapping is we looked at where are the populations that are at risk. So for example, 80 years or older who don't have air conditioning. And so those maps are overlaid, or who also are living in poverty. When we do that by census tract, we also can overlay and look at where are the public cooling spaces. So where are the populations? If we had to go door to door, we wouldn't have the capacity to go to every single home, but maybe we'd want to look at those census tracts of where we know that there are seniors living alone who may not have air conditioning, and we might want to go and see, you know, who is okay, who needs more assistance. So those are the types of things that we did with that mapping, and we will be able to bring that to you. But during the heat response, some of the things that we did is work with your communications department and post where are the public spaces that have air conditioning. So we mapped out and put on the websites and other locations, places like movie theaters and the hockey rinks, et cetera, where people can go to cool off in case they did not have access to heat. We also did community engagement, engaged a lot of the different community-based entities, the hospitals, the clinics, in a capability assessment, and really kind of looked at, are you ready for an emergency? What are your gaps in your planning? Because some of our plans really rely heavily on the systems that are in place, like the hospitals, the clinics, the community-based entities, the faith-based entities, to be able to recover quickly and assist us in the response. And what we found during that is they're not as prepared as we thought they were. So some of our 2013 plans really look at what those gaps are that they told us they were, and where we need to increase some of those capabilities and some of those, what we need to get in place for them so they will be able to respond, take care of themselves first, and possibly help us. Karen talked about the role in meningitis that we have been working on. And I also, we submitted to Minnesota Department of Health, I did include this in your packet, a one-page back-to-back. This is our 2012-2013 in-depth work plan. If it's white, we haven't really made any substantial progress on there. Yellow is what's in progress, and green is completed. If you have any questions about any of this, we don't really have time today to walk through this, but if you have any questions, you can please give me a call. But some of the stuff that we have been working on, you can see, or that we've completed, again, is related to the heat, as well as we've been working on regional family assistance center planning. And unfortunately, that became very timely because about 4 days after the Family Assistance Center training, we had a mass shooting in Minneapolis. And what the Family Assistance Center does is really walk through the process of what we would do in case we had a mass fatality, what services would need to be offered. And it unfortunately became very apparent that that we are on the right track with our planning. Another highlight from 2012 is that we had an orientation for our Medical Reserve Corps, and that's Bloomington, Edina, and Richfield. We had quite a few people interested in joining from Edina and the Medical Reserve Corps. And we continue to offer our CERT training, the Community Emergency Response Team training. And although you don't have a program specific to Edina, we do offer it and allow Edina residents to also take it. And we have had quite a bit of interest in that program as well. So our 2013 activities, we are having a full-scale Family Assistance Center exercise where we're going to actually have a disaster, and it's a structural collapse in downtown Minneapolis, where we're going to simulate that Orchestra Hall has collapsed and there's many kids there from several different schools, and we're going to open up a Family Assistance Center and a Family Reunification Center and really practice that, and that's going to be in January. Also, we are planning a City Readiness Initiative exercise. And that, for those of you who remember, that's our response to an anthrax incident. And we're going to be practicing using a new screening tool for our first responders and essential personnel. So they will screen themselves using this electronic screening tool, and we will give out medication. This is a regional exercise, so that's our portion, and several other jurisdictions are opening up a full-scale mass dispensing site where they'll run people through, the public through, and practice that, and that's in the middle of July. We will also be inviting our Medical Reserve Corps and our CERT to play along if they would like. And we continue to write the plans. That we are working on our sheltering plan and our reunification plan. We had a little bit of a snag in our sheltering plan because a lot of our faith-based entities have signed agreements to be our shelters. We did find out during the heat emergency that many have HVAC systems, but if the power goes out, their air conditioning doesn't work. It's not connected to their generators. The heat still works, but the air conditioning isn't working. So we're kind of looking at what do we need to really look at as far as what makes an appropriate shelter in the case of an emergency, because our faith-based entities and some of even our long-term care facilities don't have the ability to operate in case of power outage, and that was a huge learning for us during the heat emergency. So working on continuing with those plans, we're partnering with the schools quite a bit for the reunification plans because that's something that they practice a lot. If a bus goes down or if something happens in schools where the typical pickup isn't available, so we're working really closely with them as well for that. And that's all I had on emergency preparedness. Does anybody have any specific questions related to emergency preparedness? Emergency response? Excellent.
Do any of the other committee members have any questions generally? Karen or Lisa? I had one question, I guess. I just wanted to confirm that from your perspective, and I think this is true, and hearing what you had to say and looking at the materials, it appears as though you're meeting your responsibilities, under the statutory requirements. And meeting your responsibilities to us as the city of Edina as part of, Bloomington Public Health. I guess the question I have, is there anything that you can see that we can do as a city to help encourage residents to access services or to ensure that, that our residents are aware that these services are available to them?
Another good question. So many times services get known about by word of mouth. So I would see that your responsibility in particular is just talking about what services are available through public health, especially to maybe some people who might be struggling financially for the first time. We had this discussion in our community food partnership group that a lot of people know about VEAP, but they don't know about other things that are available in the community. So I think it's our responsibility to make sure you have that information and then that you can help pass it on. We are working with the city and with Sherry to make sure that the city is helping to promote those services via their website. But I think it's always kind of a challenge to get the word out into the community. And the other thing I think that as we start taking a look at future issues, that maybe something to start thinking about is how we start planning for people getting older in our communities. I know we talked some about that tonight, but I think we're all kind of challenged with this about, okay, we all know that the baby boomers are getting older, but what do we do? I think one of the things we do is that we need to keep SHIP going because that is really focusing on keeping people healthy longer. But there are other things that need to happen in the community also, and I think we need to start thinking more strategically about that. And that may be something to talk about next year in the community health assessment. And I know that I met with someone today from Edina, Hope Melton. Some of you may know her, and she's working on some plans around aging, that kind of thing. So you may want to put that on your radar.
Just to get back to one of your points, it's probably in the materials, but how would I refer someone? I know what you do. I think you do a great service, but I don't actually have a phone number. It's probably in here somewhere, but what would be the referral process of somebody if I were to try to connect somebody?
You would just call us. You can call me, but we have our main number that's staffed all day.
And what is that?
952-563-8900.
Great.
I think the other question that always comes up is why is Bloomington Public Health providing public health services? So that's the other thing that you know about. It just is. People get confused by that. And also, some of the other things that we try and do I think in our annual report, or maybe it's not in our annual report, but I think in the quarterly reports, we have a list of the community groups that we sit on because we try and kind of embed ourselves in the community on these different groups, and that's really helpful. In fact, I was reminding your assistant police chief, Dave Nelson, the other day that a couple of years ago we had put together a little resource card for the police when they go out on their welfare checks. And he was saying, well, I don't really remember seeing that. And I said, well, the Edina Resource Center put them together. So, but there's been a couple of changes in the Edina Resource Center. So now they're trying to hunt up this little card that they used to have so that we can make sure that the police officers have that. So there's always, turnover in staff. But as we are part of these other community groups, that's one of the things that we think that it's important for us to be there. Do you have any comments? I don't.
Any other questions? Thank you.
Thank you very much for your support. Appreciate that.
Chair Doskotch, part of the reason we have Bloomington Public Health come to present each year, they've been here a couple times this year, is to give us an overview and a final idea of what their accomplishments have been for the city of Edina over the past year, and for our consideration, in our opinion, do we feel their services is fulfilling the needs of the city of Edina? And I would hope you would consider a motion of that sort. The contract to renew with Bloomington will go forward to the city council in December, and they would appreciate comments from the community health committee.
So you're looking for a motion for?
If the community health committee feels that the services being provided by the city of Bloomington Public Health are acceptable, they're meeting our needs, we would like them to continue such services, and that would be our recommendation for council in December.
I would certainly move that we continue the contract with a Bloomington Public Health Service. They are obviously providing us with a very necessary service, including and not limited to access to services as well as information related to the needs of our community.
I second that.
Any discussion? All those in favor?
Aye.
Opposed? Motion carries. I guess I need to say that.
Actually, Kieran, I do have one more question for you. Nancy, Pinkers. Do you have any way to help the Edina school systems measure BMI on the kids?
No, we do not. It's a very time-intensive kind of thing. But you know, as I will mention it with having said no, because we've kind of talked about it before in terms of might that be something that would be really beneficial to everybody, but it's so time intensive, and then you know the kids move along from grade to grade, and if you do it once, what's that going to? I mean, it will tell you something, but what you really want to see is change over time. But the other thought I have about that is, you know, there's a big push to and for much of the metro area, the major clinics and hospital systems have electronic medical records, and they are collecting that information. So I think where the push should be is to be able to get information out of those electronic medical records and to be able to aggregate them by zip code, so that actually it's a great source of population health data and would be so valuable to us. So I think that, you know, in some of the bigger picture meetings, there's actually an e-health advisory committee to the Department of Health, and I served on that for a couple of years. And so we've actually kind of been starting to have conversations about that and to take a look and to see if we can get that data, because it's all in there. So it's kind of, you need to get the data out. I mean, how do you get the data out can be more complex, and how you aggregate it by zip code and making sure that the information is accurate is the other thing.
Just to follow up on the BMI thing, my other job, real job, we worked with the Department of Health 3 years ago to do BMI statewide, and I think 2,000 third graders. And there were a couple of randomly selected Edina schools, and so I think there's at least a tiny bit of data. And there's supposed to be a follow-up survey, which I don't think we'll partner with the Department of Health to do, but there is going to be that follow-up survey. So there's a tiny bit of data that is probably available, and be pretty easy to get, I think, because I know they tracked it school by school, and they will be doing some follow-up. But it's a real challenge, just because, you know, I would sit on the committees just trying to figure out how to, because we did oral health and we did BMI, and it was so challenging because with oral health it was easy to figure out what the next step was. In terms of connecting people with resources depending on what was found, but now with BMI, it was really, really challenging just to kind of figure out, okay, well, depending on what the result was, well, then what? You know, what constitutes an urgent reading number, and then how are you going to connect that person with the clinic, and then what is that clinic even going to do? And it was challenging, but there's a little bit of data out there, and more to come.
The other issue is, like, Hennepin County does a SHAPE survey every 3 years, and that's a countywide survey. And we also have some information from that. But I think one of the things is they tried to do the child health portion of that survey. One of the things that they found out is that parents really were not tracking very well how much their kids weighed. If you asked them, they couldn't really tell you how much their kid weighed or how tall they were. So it's just, you know, and kids change all the time. And then there are all those ethical issues around, if you're going to collect that data and you find a problem, what do you do? And that's, I think, what you were talking about. So is that a research project, then, I'm assuming?
Yeah, it was a project funded through, I want to say, HRSA or CDC, but it was, there were kind of two concurrent surveys that they decided to do at once. One was trying to get baseline oral health and sealant data. The other one was related to obesity and BMI. And so instead of doing two parallel groups randomly crisscrossing each other throughout the state, it made sense to just do one and do both height and weight and oral health. So yeah.
Tough issue. Thank you for your question, though.
All right, I'm going to move on to the next agenda item, which actually we're going to move down to 6C, which is statewide health improvement program SHIP update, and what we have is just a written update of that, I believe. I believe we received the materials ahead of time. You might not have had it. Did we provide that? Do you know?
That went out with the agenda.
Okay.
Yes.
All right, was there any comment on it? The items that were discussed in that particular update were community food assessment, healthier concessions, bike and pedestrian counts, and safe routes to school, work group convening. I'm just seeing if there's any general comment or anything the committee would like to comment on. Hearing none, I'll move on to the next agenda item, which is item 6D, which is the Dewtown update from Sarah Maskey.
Hello, thank you. Just to give you a few highlights, and I've been gone for the last 5 days, so I might be a little rusty on my highlights, just so you know. Living streets was one of the first topics, and last night at the city council meeting, the franchise fee was approved. And I'm not sure, are you familiar with the franchise fee and what that does?
It's been discussed, but if you can.
I can give you a little bit of a highlight on that. What the franchise fee is basically a fee that's attached to your utility bill. It's about $1.45, I believe, a month. And what that will do is create a fund that will then go towards bicycle and pedestrian improvements. And it is a step in the larger direction of living streets, which is a policy that will include all forms of transportation, including biking, walking, transit, cars, as well as looking at your community as a livable community. So looking at neighborhoods, making sure they're cohesive, retail centers, those kinds of things. So franchise fee is just one step in that process. And then Dewtown is going to be working in the next several months to kind of garner support and educate the population on what the Living Streets policy is. We haven't really determined what that's looking like at this point, but we will be participating in that. The school food environment, the food and school groups here in Edina has actually began meeting with the school board members to kind of discuss the school food program, how parents can be more involved, and the new staff at the school district is actually really engaged and excited about having more parents involved, so that's really a good step in this process so that parents can give their input as to what they would like to see in the school food program, as well as the food environment in the schools as a whole. Safe Routes to School, just a back update on October 3rd, which was Walk to School Day. We did have several schools within the area participate, and city council members and the mayor did attend different schools to go out and encourage the kids and to congratulate them on walking to school. And so that was a good success. One of the things that we're working on in the 3 cities is the bicycle rack cost sharing program. One of the things we found out recently was Commuter Services, which actually resides here in Edina, does actually give away free bike racks to businesses within the 3 communities. So we're going to be working with them closely on getting those bike racks out. They have 20 a year that they give out, and they've given away 1, and it's October. So we're going to help them kind of finish that project and find businesses within the 3 communities that need bike racks. Community gardens. One really exciting thing that has happened is I had a conversation with Greg Hanks, who is the executive director at Southdale Y. He's very interested in pursuing a partnership with the city on doing a potential pilot community garden at Yorktown Park. So that's the area that's just north of the Southdale Y, right behind the skate park. So I have not had that meeting as of yet, but very excited about that.
And there's a later agenda item we'll get to, which is going to be we'll have a discussion later about our support of having a community garden at that location. So that seems like it'll work well.
Yeah. And I think that's one of the things that we really have talked about is the more people we can pull into this pilot program to see how a community garden could work in Edina, I think the more successful and the more it gives the city a good reason to do that. And communities across the Twin Cities, their WISE, have been participating in community garden projects. So this is something that they're embracing as a project and something that they can pull into their programming, which is a really exciting thing. And Park Lawn. So this was a really exciting development that happened just before I left. So the capital improvement plan for the city was discussed in a work group at the city council meeting just prior to my leaving, so about a week and a half ago. And in that plan, they had put in funds for a path at Lake Edina Park, which would connect that community with Cornelia, or what's the name of the school?
Cornelia.
Cornelia, yes, Cornelia Elementary. However, the other piece of that is that the community was really looking for a place where their kids could go play. There's a lot of problems with the kids playing in the hallways of those, the multi-level units there, and playing in the streets, playing in unsafe areas because they have no playground. And so what was really great was as Dewtown went out to those areas and talked with the residents, we gained signatures in support of having a playground at Lake Edina Park. And the city council heard those citizens, and as part of the planning for the capital improvement plan, they decided to put in funds to do a plan for a playground at Lake Edina Park for the Park Lawn community. So that was really exciting. So I think that's going to be a great benefit to the community. They have no place currently for those kids to play, so that's really great. And then Healthy Concessions, we're working very closely with SHIP on this, but we're working with the Braemar Ice Arena to just kind of survey those folks who use the arena on a regular basis to find out what they would like to see in their concession stand as healthier options. So those are the basic highlights. Any questions?
I'm sorry, did you say that path is going to go in Edina?
Yes, they
Lake
did
Park?
budget in 2013. They budgeted funds for that path. Of course, that plan doesn't officially get approved until the end of December, but yes, it is in the capital improvement plan.
Sarah,
Yes.
could you talk a little bit about what was mentioned at our meeting today with regard to Veep and their possible involvement with the pilot community garden? And also a little bit about the documentary that's underway
Sure.
for the overall Dewtown?
Yeah. So while I was gone, Veep had made mention that within the 3 communities that they might be interested in having a plot at one of the community gardens in each of the communities, with that plot being that whatever is produced in that plot would be dedicated to go to Veep. So maybe they're not getting enough of certain produce, and so they could be growing it themselves in order to benefit the folks in Veep. So that would be another potential partnership within the community garden network within the 3 cities. So that was really exciting. And as part of the Dewtown project, as Sherry mentioned, there is going to be a documentary. It's going to be a very short documentary. It's about 10 minutes. So throughout this whole process, we've been filming both the Dewtown staff as well as the professional film company that is producing the video has been filming different stories, things that have been happening within the 3 communities so that they can tell the story of Dewtown and tell the successes and things that have progressed throughout this 18-month time period. So as you can imagine, 10 minutes is not a whole lot of time when you're talking about an 18-month time period in 3 communities. However, we did have the opportunity to just kind of scan through some of the video that they've already shot and some of the stories that they're looking at. And Park Lawn is definitely one of the stories that is kind of high on the level, just because it's been such a huge success and such a win for the city of Edina. And Edina's had a lot of great wins, so.
ways to start some of this stuff. And they're also good as resources for what are some of the best things to grow.
Yeah, and that's a great tip. I know
We
Katie.
have many members in the Edina community.
Yeah. Katie Meyer, who is the organizer with Dewtown, who works primarily in the Edina area, she has many connections with the Master Gardeners and so yes, we'll definitely tap into them. The other resource could potentially be the Scouts. I know Eagle Scouts have built raised garden beds for other community gardens, and that might be a potential partnership again too with the community gardens. So there's a lot of opportunity there.
And some of the schools have also done community gardens, and they've worked really closely with the park department and some of the other city departments in terms of getting the soil and the compost and the boards and all that kind of stuff. So they've got lots of good resources here in Edina.
Definitely. We're very excited about the opportunity.
With regard to the school food environment, I know we had
Yes.
discussed potentially this committee providing some additional support on that. Is there anything you see right now? I can see, making contact with Randy Smazel, who's now, running the district wellness committee. And I know there's a wellness policy that the school district has, and maybe that's a way we can try to help affect some change with regard to health of students, is looking at that wellness policy and working with Randy in conjunction with the parents that are also looking at food. But is there anything you can see right now that we need to do on that front?
I think kind of, because really when it comes down to what's going to happen at the school level, they're going to be kind of a driving force in that. And I know anecdotally there's probably going to be at least one or two folks on the school board who are going to be real champions for the healthier school food environment. So I think that I would like to hear back from them first, and then I can follow up with you.
Thank you.
Yes.
Any other questions? Thanks.
Thank you.
Our next agenda item is resolutions and recommendations update. The only open item right now is the community gardens item, and you'll see you have in front of you somewhere, hopefully, a copy of a letter, a draft letter that I've put together on behalf of this committee. I don't know if, and I guess what I'm looking for is whether there's going to be a motion to meet the recommendation in here, which is that the City of Edina support and fund a pilot program for a community garden at the Yorktown Park. So I'd be looking for a motion to move that forward.
I move to make that.
Recommendation.
Thank you.
There's that. Discussion?
I just think it's a great idea. And I think it's about time we did this in our community.
Any other comment? Discussion? All those in favor?
Aye.
Aye.
Opposed? Hearing none, motion carries. I will send that out sometime in the next week, essentially.
Matt, I'd just like to thank you on behalf of the committee for the hard work you did putting into this, for the hard work that you put into putting this letter together. I really appreciate it.
My pleasure. The next agenda item is 6G, which is the 2013 work plan and report / recommendations. I think what date that was, September 19th, was it? September 19th, I believe. I went and presented our 2013 work plan to the city council, and I believe we previously discussed it and approved it. It was not changed. The city council approved that work plan and said that we should move forward as is. So one of the items that came up quite a bit in the discussions of the different work plans at that work session with the city council was the kind of cross communication between different commissions, boards, on committees within the city to make sure and ensure that there was discussion going, if there's health concerns, living streets, safe routes to school, those things. And so making sure there was clear communication between the different groups. I know that there were past discussions about having something that was on the order of chairs having a quarterly meeting to discuss those issues. I don't know if that's going to move forward, but it's certainly going to be, I think, more enhanced communication between the different groups supporting the city council. So I think those are the main highlights. I don't know if Sherry has anything to add.
We talked about how we could partner with some of the other boards and commissions, and this community garden is going to be a prime one, because Park Board is also highly interested in it. It's on their top of their radar screen right now. And part of the letter that Matt put together for us recommends that the two boards meet together and coordinate some of the more specific things to work out what the actual community garden pilot would look like, and then send that in support to council to make it a reality. So that'll be a good opportunity for those two to work together. And we were just wondering from that meeting with the council if any of you had ideas of topics that, projects that are up and going that we could partner with one of the other boards and commissions.
And one of the things I guess I can suggest too is that from time to time I'll go read the minutes from the other boards, commissions, and see what they're working on. So that would be, I guess, a way to also generate ideas for collaboration.
I was
one
wondering
of
if
them-
that's not, are meetings disseminated to all the other chairs for meetings?
The meeting minutes are online,
Okay,
so you can pull those up. Is that what you mean?
yes.
Yeah. So you can check them anytime. I don't know how quickly they get up, but at least there's general kind of projects and themes that come out and show up from month to month anyway. And so it's just good for us to I think, be abreast of those other things. And it's a worthwhile activity.
But that requires somebody to remember to do that on a regular basis. And I guess I'm wondering if we couldn't implement some kind of procedure that after every meeting kind of disseminates meeting notes to at least the chairs of the other committees.
I can bring that up and try to make sure.
People
that
sometimes
it's-
get busy.
Yes, I'm aware.
One of the things that we talked about during the meeting with the council, Matt, was with regard to the Human Rights Commission. We're talking about bullying and efforts, and that would be another potential pairing of the two different boards and commissions on working together. Our student member, Helen Reeser, did some homework, and I believe I put that information at your packet, with regard to some of the student groups at the schools working on leveraging through some of this stuff and making a difference. And the new video that's out, and I'm running blank on the name, maybe Kaylin.
Alec Fisher made that
Yes,
video.
what it was the name of that again? Yeah, Minnesota Nice. So there's some progress going on that, and possibly we could team together with that group and maybe the police department to move that forward a little more.
Was the showing on Monday night of that? I know that there was a showing, and then Paul Andrus, one of the counselors at Southview, was going to be there to talk.
Yeah, I believe that occurred. And I think the other thing with respect to that particular issue is that the ninth grade, most recent ninth grade survey, youth survey in Edina showed, relatively high percentages related to a few questions related to bullying that were at or around the state number, which, in the 40% range. And so those would be issues I think that we need to really assess, and essentially what these questions relate to. And I'll just read the two questions. With regard to answered about once a week or more during the last 30 days, how often has another student or group of students made fun of or teased in a hurtful way or excluded you from friends or activities? And in 2007, the percentage was 37% for the ninth grade students in Edina that were surveyed, and then 41% in 2010. So, and the state average is 38%. So those are pretty, pretty significant numbers. So just something to, I think, keep in mind for this particular committee, and something that we definitely should keep in mind as we work to put together our recommendations for a report next year, certainly.
What about the transportation committee and the bike issues? What have they worked on? Is it as far as the bike paths and the making safe streets?
So transportation will be two things. It'll be living streets and safe routes to school would be the two items they're promoting. I know there's a safe routes to school work group that's now been put together to look at that issue. I don't know enough about the specifics of that, either of those issues, I guess, to really comment on it right now. But I think it is, again, something that we should be keeping abreast of and understanding and providing our support, as both of those things will hopefully result in a healthier community by improving ability for students to get to school safely, either through walking or biking, running, and also having living streets that are intended to make it a more livable, walkable, get around type of city. Okay, any other comment on coordinating with other Edina boards and commissions? Okay.
Matt, could we just back up a minute
Sure.
to resolutions? At our last meeting, we tabled the Healthy Eating, Active Living template, very lengthy template, and decided to table it. And what I put in the packet this time was a copy of the City of Egan. It's a much shorter version for your review, and I'd like for you at some point in time to come back and have consideration on that, whether that was intended for tonight or not.
I don't think it's intended for tonight, but I think we should consider it kind of in the broader perspective of, as we're putting again together, our recommendations, look at the other templates we've received. Ultimately, I think that'll be a work product that comes out at a later time. So I think it's useful information to have for now, and review, each of us review, so we have some ideas about the things that other cities are thinking about with respect to having a healthy city as we enter into preparing recommendations for the city council. So for now, I think I would intend to have that table, that particular item tabled, but it's good information, I think, to have and review.
Just when we do get to that point in time coming up with a draft, it would have to go through the different departments at the city, because depending on what we propose in there may have major impact, financial impact on that department. And I think it needs to be reviewed by them ahead of time to see, one, if it even can fit into their work plan, and two, what's the financial impact. So it's not us alone writing a one-page, two-page resolution. And
Okay, the next agenda item is correspondence and petitions. Sherry, did we get any correspondence or petitions? No? Okay, so the next item is item number 8, which is chair and committee member comments. Items that we perhaps should know about in the community related to health, or anything where committee members are actively working on.
Jan, I wonder if you would speak a bit about the Heart to Heart program.
Sherry and I attended the Heart to Heart, understanding the cardiovascular tests. And we attended on Tuesday, October 9th, and it was extremely interesting. We did go through screening on having our cholesterol checked, weight, and so forth. And I think there's going to be a report to us on the screening that took place. So we will get kind of a bird's eye picture of all and I don't know how many were screened, probably 100, 150. And they'll give us kind of a picture of what the average person looked like that was screened. And so that might be of help to us to see that certain percent were overweight, so their cholesterol might have been over 250 or whatever. So we're going to get a little screening on this, and I'm not sure exactly when that is going to come through.
They heard us that night that we would be interested in a summary of the screening statistics, and they did put in a request to the company that they contracted with to actually do the screening that night. So Alina is going to bat to find out what information we can get from them and hopefully share among us, and maybe that could give us some starting point when we do the assessment next spring, Karen, possibly some of that. Okay.
Any other items? Actually, I'm going to have one item I'll bring up is, so with respect to the work plan and what our intentions are moving in through the end of this year and then into 2013, as you'll see, we have no collected meetings occurring between now and the end of the year. I think our next one will be in January, correct? And so between now and then, as you know, we've created these subcommittees. The expectation is that the subcommittees in the interim time would be getting together to discuss the data that we have related to, youth, general health, and aging, and start working on and thinking about recommendations that we can then give to the City Council in the 2013 timeframe as we put together a comprehensive report that will be submitted to the City Council. And so I just want to make people, mindful of being getting those subcommittee meetings in place and having those meetings between now and the January meeting.
Have all the subgroups met already? Do you know? I know the senior group has met.
I would just like to mention our senior aging group. We met over, Carolyn and I and Sherry met over at the senior center, and we had a discussion with them, with Sue, and the number one problem that she related to us was transportation for the seniors. So I did some research and went over to Veep. Veep does have a program. They have 3 vans. They have a lovely brochure regarding their transportation program. And it was kind of felt that many of the seniors would not qualify because of income levels. So in my conversation today over at Veep, I did find out that there are 300 rides that they do give, and 30% is Edina, Bloomington is 40%, Richfield is 25%, and South Minneapolis is 5%. So it is being used in Edina. And they do have qualifications. Real estate does not qualify as part of it. So they do ask them what their expenses are and what their income is. So I think they would be interviewed, and I think a lot more seniors probably could qualify. So we have the second largest participation of 30%. So they do take them for different doctor's appointments, shopping, medical, pharmacy, and a visit to a loved one in a care facility. These pamphlets should be available at the senior center. So we just started at least looking at the transportation issue.
Do we have any idea what that translates to in terms of actual people or actual rides?
She told me there were 300 riders
Oh.
that are using this service. And they have 3 vans, plus several people use their own private cars. So this is a start. And we also know that Normandale Church also will take people on special medical trips of any type, and they will take people other than members of Normandale Church.
Thank you. I can also say that we've been trying to coordinate the 3 on the youth committee to meet, and there's Nancy and I have been able to meet, and I think we're going to hopefully get a date scheduled between now where we can get Mary Jo involved in some of those meetings. But some of the items I think we'll be attacking there is one is the bullying piece, Two is, obviously the focus on obesity and what we can do. And then physical activity, looking at, schools and wellness and those issues. So I think, we'll continue to move those meetings forward. I don't know if you've had a general health.
Not yet.
Okay, so hopefully we can get that moving forward as well.
I'd just like to remind you that we're down by 2 members also, so we're waiting on council appointment to fill the vacancies we have on our group, so we'd have 2 more people to fill in on the subgroups.
All right, any other comment?
I have a question on that. If we want to nominate somebody, do we give their name to the city council, or how do we go about that?
You would encourage that person to apply.
Okay.
Mhm.
The next agenda item is staff comments, item number 9.
I just want to bring your attention to our tentative meeting schedule for next year, because this is our last meeting of 2012. We need to check this against the new religious holiday lineup to make sure that the dates we have put down here don't conflict with that. So that's why I say it's tentative. But if you could at least mark your calendars tentatively for these meeting dates next year. Does anyone have any questions for me on that? At council request over the last year, we've moved to additional meetings, and we'll also be having our subgroup meetings.
So just, people are looking for, so the dates, tentative dates and schedule is Tuesday, January 15, and then Tuesday, March 19, and then a to be determined in March, which was related to the boards and commissions annual dinner meeting, and Tuesday, May 21, which will be a joint meeting with, I'm trying to figure out what.
Bloomington, Edina, and Richfield.
Yep, it's the
The
joint
Tri-City.
meeting, the Tri-City meeting. Then Tuesday, July 16th with a regular meeting. Then there'll be a council work session, hopefully, well, planned in July. And then a regular meeting in September, in October. And then there might be a to be determined September, which should probably be the work plan presentation to the city council. Anything else?
And then the last thing that I wanted to remind people about, and since Karen is still here, maybe she wants to touch on it a little bit. She did briefly in her presentation that we are going to do our community health assessment early next year, where we are going to meet with Bloomington and Richfield advisory boards for an overall presentation, and then we'll break out in our individual city groups to come up with our top 10 priority health issues. And Karen, if you want to add, now would be a good lead-in time, because that's one of our early projects next year, in addition to our work plan that we have for council.
Yes, in preparation for that, one of the things that we'll start working on very soon, in fact, staff is already currently working on it, as a survey monkey to get, we did this, I don't know, 4 years ago, I think, when we were doing this, but we found that, a good way to get feedback from the community is by using our listservs. So we put together a series of questions, and we got close to 1,000 people in the 3 cities who responded to the Survey Monkey. And it was really trying to get people's feedback on, we put out a series of health issues, and then they gave the responses to us. So we're going to do something similar to that, although I think we'll build it off some of the health issues that were identified in the community health improvement planning process that we just went through. So that will be the first step in that process. And then we'll bring the 3 cities together to take a look at more data. Okay, and we've also, one of the things that we did the last time around is we did a little community health profile for each city. And then at that meeting, we will break you into small groups to come up with a list of 10, if you can, We'll give you probably a draft list, and you guys can kind of mix and match or whatever. But then that list will need to go back to your community health board, to the elected officials, to kind of ratify, saying, yeah, we agree, or no, we don't agree, or what about this, or what about that. So that's kind of our process. And so that's one of the requirements that we have to submit is our list of 10. Each city will submit their list of 10 issues. And happy to answer any questions. And I think the challenge will be when you ask if you guys have groups of people or you have friends in the community that you want to forward that survey out to, that's how we really got it out into the community last year. We had a lot of good contacts with the school district. We have probably much better contacts now with the faith communities, but just trying to reach out into the communities as best we can, because we do tally those by community. So whatever you can do to help get the word out on that with the different listservs within the city, that would be a good idea also. We've also had some talk about trying to get it translated into Spanish, at least in one language. The last time we did that too, but we didn't have it available electronic. We had hard copies that were, and if you've ever seen, those surveys that you would print out a paper copy, they don't look very nice. They're really long and they're so much easier to do online. So, but we didn't quite have the technology down last year, or 4 years ago when we did this. So that will be probably the new thing we're going to try this year. So.
Any other items? Okay, is there a motion to adjourn? Assume there's a second to that.
I second.
In favor?
Aye.
All right, meeting's adjourned. Thank you.
Hey, Matt, who else resigned?
What's that?
Who else resigned besides Julie?